This is the ATI Pharmacology Chapter 2, Safe Medication Administration and Error Reduction. The providers who can legally write prescriptions in the United States include physicians, advanced practice nurses, dentists, and physician assistants. These providers are responsible for obtaining clients' medical history, performing a physical examination, diagnosing, prescribing medications, monitoring response to therapy, and modifying prescription as necessary. Nurses are responsible for having knowledge of federal, state, Nurse Practice Act, and local laws and facilitates policies that govern prescribing and dispensing medications, preparing and administering medications, and evaluating clients' responses to medications. Nurses should develop and maintain an up-to-date knowledge base of medications they administer, including uses, mechanisms of actions, routes of administration, safe dosage range, adverse effects, precautions, contraindications, and interactions. Nurses can help reduce adverse events related to medications by determining the accuracy of medication prescriptions, reporting all medication errors, safeguarding and storing medications, following legal mandates when administering controlled substances, calculating medication doses accurately, and understanding the responsibilities of other members of the healthcare team regarding medications. Medication category and classification, the nomenclature. The chemical name is the name of the medication that reflects its chemical composition and molecular structure. Generic name is the official or non-proprietary name the United States Adopted Names Council gives in a medication. Each medication has one generic name, such as ibuprofen. The trade name is the brand or proprietary name the company that manufactures the medication gives it. One medication could have multiple trade names, like Advil or Motrin. Considerations. Nurses administer prescription medications under the supervision of providers. Some medications can be habit-forming or have potential harmful effects and require more stringent supervision. Uncontrolled substances require monitoring by a provider but do not generally pose risks of misuse or addiction. Antibiotics are an example of uncontrolled prescription medications. Controlled substances have a potential for misuse and dependence and have a schedule classification. Heroin is in Schedule 1 and has no medical use in the United States. Medications in Schedules 2 through V or 5 have legitimate applications. Each subsequent level has a decreasing risk of misuse and dependence. For example, morphine is a Schedule 2 medication that has a greater risk for misuse and dependence than phenobarbital, which is a Schedule 4 medication. FDA regulations. New drugs in development undergo the rigorous testing procedures of the U.S. Food and Drug Administration to determine both effectiveness and safety before approval. However, new drugs can have unidentified or unreported adverse effects. Nurses observing these can report them to MedWatch on the FDA's website. Implementation of newer FDA pregnancy labeling guidelines began in 2015. The Pregnancy and Lactation Labeling Rule mandates 3 sections for labeling: pregnancy, lactation, and females and males of reproductive potential. For administering any medication to a client who is pregnant or could be pregnant, determine whether it is safe for use during pregnancy. Medication prescriptions. Each facility has written policies for medication prescriptions, including which providers can write, receive, and transcribe medication prescriptions. Use verbal prescriptions only for emergencies and follow the facility's protocol for telephone prescriptions. Nursing students cannot accept verbal or telephone prescriptions. Types of medication prescriptions: route or standing prescriptions, single or one-time prescriptions, stat prescriptions, and PRN prescriptions. Components of a medication prescription: client's full name, date and time of prescription, name of the medication, strength and dosage, route of administration, time and frequency, quantity to dispense, and signature of the providing provider. Medication reconciliation. The Joint Commission requires policies and procedures for medication reconciliation. Nurses compile a list of each client's current medications, including all medications with their dosages and frequency. They compare the list with new medication prescriptions and reconcile it with the provider to resolve any discrepancies. This process should take place at admission, when transferring clients between units or facilities, and at discharge. The rights of safe medication administration. The right client. Verify client's identification before each medication administration. The Joint Commission requires 2 client identifiers. Use barcode scanners to identify clients. Check for allergies by asking clients, looking for an allergy bracelet or medal, and receiving the MAR. Check identification bands for name and identification number. Acceptable identifiers include the client's name, an assigned identification number, telephone number, birth date, or another person-specific identifier, photo identification card. The right medication correctly interprets medication prescriptions, verifying completeness and clarity. Read the medication labels and compare them with the MAR 3 times. Before removing the container, when removing the amount of medication from the container, and in the presence of the client before administering the medication. Leave unit dose medication in its package until administration. When using automated medication dispensing systems, perform the same checks and adapt them as necessary. Right dose. Use a unit dose system to decrease errors. If not available, calculate the correct medication dose. Check a drug reference to ensure the dose is within the usual range. When performing medication calculations or conversions, have another qualified nurse check the calculated dose. Prepare medication dosages using standard measurement devices. Some medication dosages require a second verifier or witness. Automated medication dispensing systems use a machine to control the dispensing of medicines. Right time. Administer medication on time to maintain a consistent therapeutic blood level. Administer time-critical medications 30 minutes before or after the prescribed time. Facilities define which medications are time-critical. Usually this includes medications that require a consistent blood level. Administer non-time-critical medications prescribed once daily, weekly, or monthly within 2 hours of the prescribed time. Administer non-time-critical medications prescribed more than once daily, but not more than every 4 hours, within 1 hour of prescribed time. Right route. The most common routes of administration are oral, topical, subcutaneous, IM, and IV. Additional routes include sublingual, buccal, intradermal, transdermal, epidural, inhalation, nasal, ophthalmic, otic, rectal, vaginal, enterosis, and via enteral tubes. Select the correct preparation for the route the provider prescribed. Always use different syringes for enteral and parenteral medication administration. Know how to administer medication safely and correctly. Right documentation. Immediately record the medication dose, route, time, and any pertinent information, including the client's response to the medication. Document the medication after administration, not before. For some medications, in particular those to alleviate pain, evaluate the client's response and document it later, perhaps 30 minutes. Right client education. Inform clients about the medication, its purpose, what to expect, how to take it, and what to report. To individualize the teaching, determine what the clients already know about the medication, need to know about the medication, and what to know about the medication. Right to refuse. Respects clients' rights to refuse any medication. Explain the consequences, inform the provider, and document the refusal. Right assessment. Collect any essential data before and after administering any medication. For example, measure apical heart rate before giving digoxin. Right evaluation. Follow up with clients to verify therapeutic effects as well as adverse effects. The common medication errors are wrong medication or IV fluid, incorrect dose or IV rate, wrong client route or time, administration of an allergy-inducing medication, inaccurate prescribing, inadvertently giving a medication that has a similar name. Using the nursing process to prevent medication errors. Be knowledgeable about the medications administered. Use appropriate resources. Obtain information about medical diagnosis and conditions affecting medication administration. Obtain necessary pre-administration data. Omit or delay doses as necessary due to client status. Determine whether the medication prescription is complete. Interpret the medication prescription accurately. The Institution for Safe Medication Practices is a nonprofit organization working to educate healthcare providers and consumers about safe medication practices. The ISMP and FDA identify the most common medical abbreviations that result in misinterpretation, mistakes, and injury. For a complete list, go to ISMP website. Error-prone abbreviation list. These are abbreviations that have caused a high number of medication errors. Confused medication name list. This sounds alike and look alike medication names. High alert medication list is medications that, if a nurse administers them in error, have a high risk for resulting in significant harm to clients. Strategies to prevent errors include limiting access, using auxiliary labels and automated alerts, standardizing the prescription preparation administration, and question the provider if the prescription is unclear or seems inappropriate for the client. Providers usually make dosage changes gradually. Question them about the abrupt and excessive changes. Planning. Identify client outcomes for medication administration. Set priorities. Implementation. Avoid distractions during medication preparation. Interruptions can increase the risk of error. Prepare medications for one client at a time. Check the labels for medication name and concentration. Measure doses accurately and double-check dosages of high alert medications like insulin and heparin with a colleague. Check the medication's expiration date. Doses are usually 1 to 2 tablets or one single dose via vial. Question multiple tablets or vials for a single dose. Follow the rites of medication administration consistently and carefully. Take the MAR to the bedside. Do not administer medications that someone else prepared. Encourage clients to become part of the safety net, teaching them about medications and the importance of proper medication identification. Follow correct procedures, follow all laws, do not leave medications at the bedside, and educate the client and anyone who will be assisting in the client's care regarding medications. Provide verbal and written instructions. Evaluation. Evaluate clients' responses to medications and document and report them. Use knowledge of the therapeutic effect and common adverse effects of medication to compare expected outcomes with actual findings. Identify adverse effects and document and report them. Notify the provider of all errors and implement corrective measures immediately. Complete an incident report within the time frame the facility specifies, usually 24 hours. This report should include client's identification, name and dose of medication, time and place of the incident, accurate and objective account of the event, who you notified, what actions you took, and your signature. Do not reference or include the incident report in the client's medical record. Medication errors relate to systems, procedures, products, design, or practical patterns. Social determinants of health, or SDOH. To fully implement safe medication administration and error prevention, the nurse should determine the SDOH of each of the individual client. Clients are born into SDOH conditions in the environment in which they live. These conditions affect their daily life and eventually their health. Social determinants of health account for 90% of health outcomes, whereas medical care accounts for only 10 to 15%. It is imperative that a member of the client's healthcare team collect the necessary data relating to the 6 determinants of health. Economic stability, which is poverty level, employment, and housing stability. Education, which is level of education, language and literacy, early childhood education and development. Health and health care. Access to health care, access to primary care, and health literacy. Neighborhood and built environment. Access to foods that support healthy eating patterns, quality of housing, crime and violence, environmental conditions. Social and community context, which is social cohesion, civic participation, discrimination and incarceration, and food security versus food insecurity. Healthcare team members should not only gather the necessary data regarding SDOH, but should act on the findings to ensure safe medication practices for all clients.